Hey, Dr. Tracy, board certified general pediatrician, and let's talk asthma. This is going to be very basic because I notice almost every single day in my practice that a lot of parents don't understand the basics of asthma, and I don't blame them. By the time the diagnosis comes along, they've had so much stress, there's been so many different people involved. So let's start really basic and then we can build on it from there. So, what is asthma? The easiest way to understand it is that a child or adult's lungs are reactive. And when they're reactive, they get swollen to whatever their trigger is. Their trigger can be allergies, it can be viral infections, it can be weather, it can be, well, you said allergies, animals. There can be lots of different irritants, and that irritant or trigger causes swelling inside the small airways in the lungs. The small airways then end in something called air sacs. Those air sacs are alveoli where you exchange oxygen. So that's where oxygen exchange gets put into the blood and that pushes back into the rest of the body. So when those air sacs get swollen, they collapse. And when they collapse, the body is pretty smart. So it tries to cough to force air back into them so they can continue to exchange oxygen. So at the heart of asthma, the coughing is trying to get the air sacs open because they're swollen. So when you understand it that way, it makes so much more sense. So when your child has a certain kind of cough and they go to the doctor and they listen to them and they tell you they're wheezing, what we mean when we talk about wheezing, and there's different kinds, but again, this is basic. When we hear wheezing, it's not that you can always hear it just from your ear. We're listening through a stethoscope into the chest, bypassing the upper airway noise, and we're hearing a slight little hee, 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 as air is trying to go in and out those swollen airways. In some areas, we don't hear anything because remember those air sacs are collapsed a little bit, so we don't hear any air movement. So that makes more sense when you think about how your child is acting. They're coughing, they're sometimes a little bit fretful, they're using extra muscles to try to breathe, to get air in and out. They might be winded, they might be tired, they might flare their nostrils. So this makes sense when you think about the treatment for asthma, right? So the number one treatment for asthma is albuterol, which is a medication that relaxes the smooth muscle in those swollen airways so that they can open up a little bit more. It is temporary, it does not treat anything, and it only lasts about an hour. So albuterol is a great treatment for asthma. It is life-saving, it is first line. However, it doesn't actually treat asthma, and this is where a lot of us go wrong. If you have a child with really mild asthma, and they just get a little flare up when the weather changes, when they get a cold, and you give them a breathing treatment of albuterol, their cough calms down, they look great. Doctor primary care says they look fine and they can last 3 or 4 hours in between and then get another treatment. Goes on for a day or so and then they're fine until the next cold. Likely you're doing all the right stuff. You want to avoid significant infections, make sure they have their vaccinations, talk to your pediatrician and primary care provider. But here's where the kicker is. It never addresses the primary problem, right? So if every time your kid gets sick, they end up needing albuterol, that's causing too much damage to the lungs because that's scarring and that can lead to chronic lung disease when they get older. So that's when your doctor is going to add a steroid. And a steroid is a medication that decreases inflammation. So you can have an inhaled steroid or an oral steroid or an injectable steroid. It's preferable or better if you can to use an inhaled steroid because it just goes to the lungs, it doesn't go throughout the entire body, and it can be used on a daily basis to prevent that airway collapse from ever happening with the goal that you would need less and less albuterol, less chance of there being serious complications now, and less chance of there being serious complications later. If your child has more severe symptoms, they might recommend an oral steroid, which works well, it's very appropriate. However, there's a lot more systemic side effects throughout the body, so we try not to use it unless we can help it. And if your child is frequently needing oral steroids, they should have an inhaled steroid on board to help prevent use of that. It can cause lots of different medical problems, so it's better to have it only when absolutely needed and just try to switch over to an inhaled steroid as soon as possible. Obviously, we have injectable for when a child's symptoms are bad enough they can't take something by mouth. So again, super basic, but I think it helps to understand what is asthma, Why are you using the medicines that you are? When should they be used? And how does this actually affect your child? So, to go over it again, albuterol temporarily opens up the airways by relaxing the muscles, lasts about an hour. We recommend giving it every 4 to 6 hours as needed just because of side effects. Inhaled steroids, Flovent, Asthmanex, Qvar, those are the simple ones, Pulmicort or budesonide. Those are simple inhaled corticosteroids that decrease inflammation in the lungs only, should be given when the child has more recurrent symptoms to prevent the asthma attack. Oral steroids are used when the child is not, we don't think the inhaled steroid is going to work good enough. They're acutely sick right then. Injectables when they're really sick and they need something to get in their system and we don't want it to have it by mouth. So when your doctor is recommending your asthma medications for your child, think albuterol is like a Tylenol or Motrin. It's given as needed when there are symptoms. If your child needs albuterol every day, there's something wrong, talk to your doctor. Inhaled steroid can be used every day. It can also just be used during the times when the child has the trigger, but that's up to your doctor. So I hope this helps a little bit. We can talk much more in depth, but I just wanted people to understand it a little bit better in ways that make sense. And also talk to your doctor. Get your flu vaccine. If your child has asthma, one of the number one triggers is influenza, and it can cause hospitalization, massive issues. So get your flu shot. Take care.